So I'm very happy to share that our research linking childhood trauma or adverse childhood experiences with post-traumatic stress disorders or PTSD is now published this month in journal called European Journal for Trauma and Disassociation. This is an excellent document that integrates all our insights over last couple of years of research of more than 60 individuals. What did we find out and why did we pursue this study? Let's learn more about it. First, PTSD assessment is 3 times more likely when an individual has faced repeated trauma. Not one-off events like earthquake or a natural disaster, but repeated trauma, especially during childhood. So that is one. Second, interpersonal trauma components, that is abuse or neglect, have a stronger likelihood of having PTSD assessments. These two were known facts that we reviewed in the literature and then set up the study. What did we do? We identified individuals who were at high risk and made their timelines. Complete timeline before age 18, and of course there were sometimes elements after 18. However, the focus of the study was on the childhood components. On the timeline, there were events identified based on our age 16 questionnaire or adverse childhood experience questionnaire. And then we took the approach of measuring it through index trauma. Why index trauma? Because when you take single worst incident as a representative event to assess PTSD, it does not give very high scores and it's much easier to fix. So we took the tougher approach, which is up to 3 index trauma events from childhood, and took them as a representative trauma component for PTSD assessment. And when we integrated the data, what did we find out? We identified several components that were present in more than 50% of the assessed individuals, and they are emotional abuse, present in 80%, emotional neglect, peer rejection, physical abuse, mental health or depression or suicide history in a caregiver, and finally parents fighting, and this included verbal fights. So these components were overwhelmingly present in the individuals we assessed. What is the implication of these findings? If you are a parent, please be watchful of not presenting these situations to your children. If you are a guardian, this applies to you as well, and these are preventable situations. If you are a psychotherapist or a psychologist, you should be identifying potential presence of childhood trauma components that I highlighted in your therapeutic intervention. There are 2 things here. First, there has to be clarity on what is PTSD, why it happens. There is a separate video for it. However, for psychologists or psychotherapists, this is an important component. And recognize that PTSD is not only linked to one-off events, natural disasters or accidents. There is an overwhelming role of childhood trauma components, and that increases the risk for PTSD. So look for those components. And third, this is applicable to all of us. The assessment focused on DSM and up to even DSM-5, the current latest version for assessment. The role of developmental trauma or childhood trauma is not highlighted in the PTSD assessment, and therefore experts have identified something that they call complex PTSD, which was out of scope for the project of this publication. However, complex PTSD is clearly linking childhood trauma to more severe set of components and additional components that are not measured in DSM, and that's part of the future work. So if you are not incorporating childhood trauma, it will be likely that you will not get effective results. And by incorporating childhood trauma, you are still not meeting the assessment criteria for complex PTSD, and that is topic for some other video and future work. So to summarize, the findings are very interesting and we are excited because it provides a certain template for addressing, not just identifying, but addressing the symptoms and long-term implications of PTSD.